Today's webinar is really about the John Gullo Home for Children. It's the what is the John Gullo Home for Children. First of all, we want to start there for those of you who are new to our organization and in terms of your support and following the work we're doing. Why this facility was built and for whom. What's happened since we opened the doors and where do we go from here? So that's really what the purpose of the webinar is today. We want to provide honest, direct updates since we did cut the ribbon and officially open the doors in a year because a lot has happened. So again, thank you for being here and thank you for participating today. First, I wanted to let's see if my clicker works here. Yep. First, I wanted to just introduce Leaders to Give for those of you who are new. Leaders to Give is a US-based organization. We're a 501(c)(3) registered nonprofit. And we do much of our work, not all of our work, but much of our work is done in Baja California Sur with a focus on supporting vulnerable children in that region. Leaders to Give was founded specifically with one purpose, which is to build and sustain the John Gullo Home for Children. We later began, as a result of COVID, supporting a small network of grassroots partners throughout the community to ensure that we're either directly or indirectly protecting and supporting vulnerable children by providing free housing, healthcare, education, and food security. And we can only do this work thanks to you, who are our donor community. So again, thank you. Your work is very meaningful. In order to be approved to become a 501(c)(3) organization in the United States, there's a lot that goes into it. First of all, we have to have a mission that's approved by the government of California and by the federal government. And everything we do has to align to that mission. Our mission at Leaders to Give is to teach, inspire, and empower others to become leaders who possess the skills required to solve the problems facing society. And we do that by providing others with an opportunity to engage in hands-on work in developing communities and in real-life settings. So that's our mission. Our purpose, the reason we do all of this work, is to protect vulnerable children in developing communities and communities in crisis. We are also represented by Líderes para Dar. Líderes para Dar translates to Leaders to Give in Spanish, and this is a Mexican federally registered Asociación Civil. So similar to a 501(c)(3, it's a nonprofit. And the idea being that we formed Líderes para Dar in order to hand over the operations of the children's home to Líderes para Dar to ensure that it's run and managed by the Mexican community for the Mexican community, easy for me to say, in adherence and compliance with local laws, regulations, customs, culture, and tradition. So that's a little bit about Leaders to Give and Líderes para Dar. Now I want to talk a little bit about why this home was created and why it was created, where it was created. So we'll just step back. Before Leaders to Give was even formed, myself and my wife, Tracy, living part-time in Los Barriles, were introduced to a facility called New Creation Kids. And we started doing some volunteering with New Creation Kids, raising awareness about this other temporary home for children whose families are in crisis. And I started working at the Saturday market. Sometimes the kids would come with me and we would talk about the challenges that they face, not having any government funding, the background of where these kids came from, and some of the struggles they face, and asking for the community support. It was while I was there working at the market that I was approached by an American family who lives in El Cardonal. And that family shared a story with me. They told me that they had a neighbor, a Mexican family, and you can see on the left-hand side a picture of Maria, and below that picture you can see Belen, her mother. Paloma is she's also known by. Had leukemia. Maria had leukemia, and Belen and Maria had a supportive family. they were going back and forth to various parts of Mexico to get treatment. While getting treatment, they met other mothers who were also there with their children getting treatment for cancer and various other terrible terminal illnesses. And I think it's worth noting at this point that the leading cause of death in Mexico, or among the leading causes of death, is childhood leukemia. And the second largest leading cause of mortality in Mexico is breast cancer. And the rates of these illnesses are extremely high in Baja California Sur. So while Belen and Maria were getting treatment, they're meeting these other single mothers there. And one of those mothers was a mother, her name was Giovanna, and she was also receiving care for her child, a young boy who was 4 years old. And she had four other children. And so Belen would ask, "Where are your other children?" Well, I've had to leave them with aunties, was the term, friends, in the colonies, which is up by San Lucas near the Costco. Sometimes if you're from the area and you're driving on the toll road and you look to your right on your way to Cabo San Lucas, you'll see sprawling shanty towns, sprawling slums, and you can see photos of those right there in the middle picture. And she explained that while the government provided housing for her and her sick child, there was nowhere for her other children to live. And so they were basically abandoned with friends in a very unsafe area. As a result, they weren't in school. They were lacking in education and nutrition, and they were exposed to many of the problems that happen in economically disadvantaged areas like violence, narcotics, etc. And this inspired the American family who approached me at the market in Los Barriles to want to provide support for women like Giovanna and their children. She said to me, "I have a piece of property in El Cardonal, and you can see this property on the right-hand side. There's a picture of the property where there was a small structure that was set up many, many years prior. It was being used on again, off again as a community center. It was initially being used as a health clinic before the government constructed and started to manage a health clinic in El Cardinal where doctors would come up once a month. But it wasn't really being used. And she said, "I'd like to donate this property to you to build a children's home that's focused on children whose families are experiencing a medical crisis." And thus began the mission to create Leaders to Give, a volunteer retired attorney from California who lives in Spa Buena Vista by the name of Phyllis Newton, a volunteer to set up Leaders to Give pro bono. The entire board of directors is volunteers. And we began the process of creating Leaders to Give with the sole mission of providing a temporary home for children whose families are experiencing a medical crisis. Now, of course, we didn't just take their word for it that there was a need. We did a ton of research. We had several meetings with DIF, which is the organization responsible for child and family welfare across Mexico, both at the local level as well as the state level. So from La Paz to Cabo, we met with different people. We met with doctors at FIPCAM. FIPCAM is another Mexican nonprofit that exclusively service women living in poverty that require cancer treatment in Baja California Sur. Their lead physician also confirmed the story that Belen and the lady who had donated the land were telling us that there is a need and that often women who are seeking treatment either for themselves or a sick child are left with no other choice but to abandon their children. A number of other social organizations, social workers and other organizations that are focused on this problem in the area also suggested and committed that this is a need. And interestingly, that there is no other facility in Baja California Sur that does this specific thing. So it's a need, it's new, and they were very, very excited to participate and to work with Leaders to Give and Líderes para Dar to see that happen. We hosted town hall events. So you can see in the top picture on the right, there's a group of officials the former mayor, um, uh, prior to Belen herself becoming the mayor of Cardonal are there. You can see the third person on the far right is Hector Bori, who is also the president of Líderes para Dar and sits on our board of directors. It was in attendance, communicating the vision, communicating the mission. And you can see in the bottom right members of our Mexican Líderes para Dar board of directors, Juan Carlos Esquema, who is an accountant with a leading accounting firm out of La Paz. You can see Belen there and other officials from the government. So the feedback was overwhelming. The service doesn't exist, but it was needed. And our research online, where I learned about, the poverty level of folks living in Baja California Sur has increased by over 200% over the last decade, and about the leading causes of death being breast cancer and childhood leukemia. And so we underwent this project, a very ambitious project, to build this children's home. The idea being that in association with DIF or in collaboration with DIF in various facilities, children would be identified with having a need. They would go through our intake process, which is led by Belen and Sarah, and I'll introduce you to them shortly. And then they would determine if the child qualifies to fulfill our mission. Remember, in order to be eligible to be a tax deductible organization as a 501(c)(3), we have to fulfill that specific mission that I outlined earlier. And so it's very important that everything that we do fulfills that mission to ensure that we maintain our status. But it was a major ambitious project. We built a dorm for girls that holds up to 12 girls. We built a dormitory for boys that holds up to 12 boys, washrooms and showers in each for privacy. We built a common area with a commercial kitchen, a commercial laundry facility, and a large common area for meals and movies and just some time together, as well as two apartments, as we knew that we would require on-site staff to be housed and volunteers. And so ground broke, I think, in 2019, right before COVID. And of course, COVID created a lot of problems and a lot of pauses. But over the course of 5 years, we managed to build the facility. And it wasn't just us, right? Again, I mentioned this is a all volunteer organization. Nobody that is on the board is being paid to do any of this work. We're doing this because it's meaningful and it's purposeful, and we want to make sure that we're present and engaged in the community where many of us, but not all of us, live. And the community responded. It was a huge community effort. Individual donations to build the facility, individuals coming and painting, assembling furniture, donating furniture, and participating from digging the first hole and putting up the bricks to painting, mortaring, and furniture assembly and more, as well as people from Canada, the United States, Rotary clubs in Canada, other nonprofit organizations across the United States, issuing grants, making donations to see this home come to fruition. So it was really, really an incredible project. We're very, very proud of it. We had to meet licensing and legal standards. We had to hire key staff, and I'll introduce you in a moment, and make sure that the home's functioning properly, that we're working with local government, that we're able to host site visits by agencies, conducting interviews and hiring staff, and ensuring that it's a safe, licensed, and permitted place to protect children. So you can see here in the pictures the various people that were involved. There's some pictures of the boys' dorm. There's some pictures of the girls' dorm. The playground area, you can see in the bottom right, the dining and common area. One of the apartments for the deputy or the assistant facility director, Sarah, who will be speaking on today's webinar. You can see the beautiful commercial kitchen, thanks to the Rotary Clubs of the Sea to Sky in British Columbia, Canada, for their generosity and support. And even more recently, a garden was installed thanks to some generous donors, including board members, in honor of a child from the United States, a member of our community who sadly passed away from cancer herself. It's called the Garden of Light in honor of young Maddie. So a tremendous, loving, and caring facility that is ready to go. and host children. Um, okay, so we have hired two incredibly talented and committed community leaders to run the organization, to engage with the local community, to handle the intake, to work and identify volunteers to supplement their work, and to handle and to care for the children when they're at the home. That is Belen Sendez, who I mentioned was part of the inspiration behind this story and experienced this need firsthand, as well as Sarah Lucero, who's gonna speak directly to the community about what has happened since we opened. You know, what work has gone into making sure that we are reaching out to hospitals, to clinics, distributing flyers and posters, talking to families in need, working with the local government authorities to ensure that people are aware of the facility and understand how to place their children here over a temporary period of time. I'm also going to ask Hector to speak as well and share his insights, as he also participated in many of these meetings and has also heard firsthand from the community what an important facility this is. So Sarah, thank you for joining us. Would you like to share with our audience all the work and the different facilities you've been visiting and the conversations you've been having over the past year?
Thank you, Adam. Well, I'm going to talk about all the work that we have been doing all this time. And I want to start saying that at the beginning of the year, we toured of the most important radio station to publicize our home. And throughout this time, we have been holding meetings with various hospital and association that, due to their mission, can actively collaborate with us. People tell us that there is a need, and we have been congratulated for our work. Some of them are FIPCAM, AC, Women Wellness from Los Cabos, Diseñadas para Crecer from La Paz, Línea de Vida, AC, Azul Cerralbo, AC, Cabo Children Foundation, Registro de Cáncer en Baja California Sur, Oncoloreto, Oncola Paz, and many more. Next, please. So when we have our first child, we saw our purpose fulfilled, but also made us aware of many areas for improvement, such as the safety of our home, improving our income filters, and seeking to expand our network of volunteers. Next, please. So I don't know if you want to say something in this part, Adam?
Yeah, I think it would be helpful, and Hector, feel free to add some color. You know, when we cut the ribbon in November, there was still some work to do. So we were doing that based on the timing of people being in town and availability with Thanksgiving and Christmas. But we wanted to look, the facility was completed, it was ready. Obviously, we weren't totally ready to fully be operationalized, but nevertheless, we cut the ribbon, we were open. That was in November. And the first child was identified and came to live at the home in, I think it was April or May. So pretty quickly that happened, and all of a sudden we're excited. Okay, this is real now. Um, what were some of the challenges? What did we experience? What did we learn through that process? And maybe Hector, you can add from your own experience through that process.
Happy to do so. Good afternoon, everyone. What's been very clear to us as we have expended or spent a significant amount of time and dedication and structure into a very detailed outreach program, which Sarah and Belen have done an exceptional job, not only hosting meetings at the facility itself, but going up and down the Baja Peninsula, meeting with hospital authorities, administrators, physicians, community organizations, other homes. It's been an exhaustive process. Is that number one, there is an absolute reiteration of the need. Everyone that we confront, spend time with, has nothing but effusive commentary about how important this is, how this is my term, a space in the universe that is not being taken care of by anyone else, and that we absolutely need to continue to focus on this because it is necessary. We've had actually meetings where we have physicians brought to tears when they hear about the inspired and dedicated support that the Mexican community has received from the foreigners, from the American and Canadian foreigners. So it's been absolutely overwhelming. Equally, there has been a couple of consistent themes, if you will, that come from that we have discovered from all of this time. Number one, the problem that exists as one of the biggest factors is distance. Where the home is located right now is a challenge. It's not close to any major town or community, of course, excluding Los Barriles. But when you think about the density of population where you would have families and people in need like this, it is far. Number two, there's an economic reality of the town. There's a limitation that families that find themselves in this situation have to deal with, and that most of them don't have a car, and if they do, they don't have the resources to come to a place like ours. We are addressing that. We recognize that. We're actually going to be fundraising so that we can purchase a vehicle to try to ameliorate that. But the reality is that is a problem. The second major theme that we find, despite the need, and because we don't find ourselves in a major community, we are not, my term again, understood or considered neighbors as part of the community. The Mexican community is a very, very close family-oriented community, and trust is a very big thing. You can imagine if you personalize finding yourselves, God forbid, in this situation where you have a child that's having to deal with this, or an adult, a parent that's having to deal with a serious life issue like this. The need for huddling support by those that are closest to you is indispensable. And the thought of leaving your children in a place where they do not know you because you're far away, you're not part of a community, is an obstacle as well. Despite the realization and the consistent commentary about this being a need, a necessity for the community, that is a reality. So those two major categories are the things that we're finding right now. Despite that, however, we continue to work on that outreach program. Belen and Sarah have done a fantastic job with this. Now we're transitioning. One of the things that we found out was that we felt it was more important to, yes, talk to the hospital, the administrative, the bureaucratic side of the healthcare system, if you will, the family system, but we need to get closer and closer to the families themselves. So we've actually begun focusing on the social services organizations that are directly dealing with these families, and also through that connection, trying to meet and develop relationships with the families that are in the middle of that storm themselves. So that's where the focus is right now. And those are the major learnings as far as I'm concerned.
Thanks very much, Hector.
You're very welcome, sir.
And thank you, Sarah, as well, for all of your hard work. If I was to summarize, where we're at, yes, we've had a child come through. We had another 3 children who were identified and were on their way, and then the parent's surgery was canceled and it's been delayed. So we're expecting them at a later date. And the work continues as Sarah and Hector have identified. But I think the top challenges are, a lot of families still need to know that the home exists. So how do they find out? Well, they find out through the work that Sarah and Belen are doing. The model is new, so a lot of people just don't know what it's for. They don't understand what it's for. Many people, including our donor community, still think it's in the United States and Canada, it's sort of like a Ronald McDonald type of house. That's not what this is. This is for healthy children, a place for their healthy children to live, be loved, cared for, go to school, and be fed and sheltered while their sick sibling or parent is experiencing a crisis. Of course, families are understandably hesitant, to leave their children in others' care. Yes, it's a terrible situation and they often have no choice. However, it's still very, very hesitant unless they know you. And so a lot of the work that we're doing is getting to know the people who are afflicted most, and that's the work being led by Sarah and Belen. And of course, the referral process can be very, very slow through hospitals and DIF. Again, remember this home serves a very specific need, which is temporary care during family crisis. And our emphasis, just to be clear, our emphasis is not on volume. We don't look at this as success based on it being full. We look at it being successful based on safety, the level of care we can provide, and appropriateness. So as Hector and Sarah mentioned, what we're doing now is a sort of a 90-day outreach. This began in September and is beginning to wrap up. Visits are happening in La Paz, Laredo, San Jose del Cabo, Cabo San Lucas, building relationships, as mentioned. I'll just repeat it. It's worth repeating with DIF all the way from Loreto to Cabo San Lucas because every community has their own sort of isolated DIF with FIPCAM, Corazones, Por Cabo, the hospitals, as well as even the state prosecutor's office for children and adolescents, as well as the biggest hospital in Baja California Sur, which is the Cabo San Lucas General Hospital. So we've been receiving direct referrals. Sometimes the referrals we get, and the board is looking at this now, again, with safety and appropriateness in mind. Some of the referrals we're getting is not a fit, and we have to be cognizant of that and make sure that if we do expand sort of the scope, then we have to make sure that we can deliver on our promise for the proper care. We're also hosting weekly art workshops and community activities in the home. So we're bringing the community together to A, expand our volunteer network, B, to ensure that local families are aware and the word spreads organically, and C, that when it is full of children, because again, there is a big need, that it's not an isolated facility, that it's part of the community and that the children aren't over here while other children are over there, but there's an assimilation. And now we're also planning town halls throughout Baja California Sur to ensure that the message is continuous and engagement. So this brings me to you. How can you help? Because we get a lot of comments and a lot of questions. Some are very well-meaning. I want to help. How can I help? Some are not. Some are very critical, which is really difficult for us as volunteers who trying to do the right thing to get criticism because it's not full yet and people want instant success. And so how can you help? Well, this is not a fundraiser, first of all. So we're not here to ask for money. We're here to communicate where we're at and where we're trying to get to, and to emphasize that this is a community project from digging the first hole, from the money, which was hundreds and hundreds of individual donations, as little as $10 and as much as $100,000, to people coming and painting and building furniture, etc. It's a community facility and a community project. So how can you help besides making a donation? Well, share this with your friends and family. Share this with people that you know. Talk about it with your Mexican friends and neighbors. Help shift the perception of the home when necessary. We're going to, and I do see some hands raised, so I just want to let you know we're almost done and we're going to open it up for questions. So thank you for your patience. But yeah, share the recording. So we've recorded this and we're going to share it with everybody. Share it with others so that they know about the facility. This webinar is being done in English. Belen and Sarah are doing the same thing in Spanish in the Mexican community. So this is specific for our donor community. Volunteer locally, you can do that to help, whether it's with us or whether it's another nonprofit, to show your commitment to the community engagement. You can help distribute flyers and posters in clinics, communities, and schools. And be kind, be understanding, and be supportive. So that's really how you can help, and that's what we wanted to talk about today is who is Leaders to Give? Who is Lideras para Dar? What is the John Gullo Home for Children? Excuse me, why was it built? What's happened since we cut the ribbon, and where do we go from here? And with that said, I will turn it over to questions. And definitely welcome your questions.
Good afternoon. My name is Maria Madrigal Disqua, and I am actually, I was born in Ensenada, Baja California, Norte. And I was one of those kids who was in a situation similar to what you guys have done, which is what caught my eye to want to share my thoughts of why you might not have the numbers you guys have. And I just thought, having been in those shoes, I wish that you guys would have been there for my family. So I'm the youngest of 10 children, and my sister, which was a little older than me, had some health problems. And so when I was born, my mom was traveling a lot to Guadalajara for her health. And so what I see is that when we have a large family, we lived on an ejido in a little 10 by 10 room, all of us, and we had an outhouse. And I wish that I would have been left in a place like that instead of at my home, where there was a lot of chaos and a lot of, just siblings raising you, and there was a lot of just malnutrition and just poverty, all the things that you guys are really just doing an incredible job, to meet those needs, and the focus that you guys have is very, like a mission should be, very specific, uh, and so I commend you guys and congratulate you guys for all of that. But I think me personally, I think what was hard for my mom to do was to leave the kids and just the message of saying this is a place just for kids. It's it's almost scary because, like you guys said, there is a lot of um, community or uh, tias that are not related to us, people in the community that just come to help because that's who we are as a people. To make the long story short, my dad ended up running my sister over after she came back from the hospital. She couldn't walk, and she died, and we buried her up in a hill. That's not even a panteon, a gravesite. We just left her there. And we just didn't have the resources, and we didn't have the knowledge. My mom went to third grade, my dad went to second grade, and here there's a bunch of kids. Now, I uh, I've gone back to Mexico, and I'm living here in the United States, but I'm planning on retiring in Ensenada. So I bought some property, and I'm doing my own thing there. Just feeling like I need to go home and close the circle. But I think what I hear that I think you guys are doing great is reaching out to the families, really, going out to the community. And I would probably suggest like going out to the ejidos in particular, the land, an ejido, like lands that were given to us, uh, people who were in economically disadvantaged by the government. Those lands were given to us just to work the lands. And right now we have a large, at least in Ensenada, a large population of people coming in from Oaxaca, working a lot of the agricultural land that we have there, and looking to those communities. And I think, again, the things that you guys are doing right is, having those little workshops, having the garden, but, more than that, creating that and fostering those relationships, because that's how people, get to know the communities or the places. And because you guys have identified, the location, as you guys know, with real estate, everything's, about location, is that you guys are way out there. And so in Ensenada right now, what I have seen in my community in particular, where I'm at now, which is Maniadero, going towards La Bufadora, we have a lot of the churches from the United States going to build these little houses, these little wood houses in our communities, and so there's up and coming communities. So, an idea might just be that, as a volunteer, and they're all volunteers, it's like the church will raise funds for a house for a family. They meet also, they have certain requirements of, they must have kids, they must, have all these the requirements. Long story short, they build them a house. Volunteers just go build a house and, put it up in a day. It's all made of like wood and stuff, but they're pretty nice houses. And they meet that need, but it's creating a community, a large community in our area of where we're living. So maybe that idea of, those same volunteers that, have funded what you guys have done so far can almost, create a whole community around, the area by, maybe giving those opportunities of little casitas, to build in your area. If that's, I don't know about the land. There's a lot of things up with Mexico and land, but those are just my ideas. And and like I said, I wish that you guys would try to kind of maybe reword the concept of, we just want kids, because you're making, at least for me, I, if you would have told my mom, like, we'll take your little girl, like just me, just the last one, because I was the youngest, like I said, we'll take your little girl and we'll house her here, so that way, the older siblings don't have to care for her because they're already, caring for the household. My sisters were washing the clothes, were uh, feeding us, and just, we had, I think, like a pig and some chickens, and so there was just basic things, and they too wanted to be kids, and it just wasn't fair, because they were older, and so they were like obligated to care for the rest of us while my mom was out, and my mom felt obligated to take me along with her to care, for me while she was struggling in the hospital. And I only know of all of this really because of stories, and now that my mom is dead, paperwork that I've seen in briefcases and things of that sort, that I see that I was tagging along in this really difficult process. And I can't imagine what that must have been like for my mom. So just rewording, and instead of just saying like, we're going to just take your kids, that concept is scary for a parent, and for a Mexican parent in particular. Culturally, we will leave our children with complete strangers, but we call them tío, so like, even just calling it, like casa del tío, just the verbiage, the words are super important for us, and not making it feel, I guess, I don't want to say this and be disrespectful to all of the work that you guys have done. So please correct my words if they don't come out, you know, sensitive, because I don't want to hurt your feelings, because I know how hard you guys have worked. Making it feel more ghetto than as aesthetically pleasing as it is, because there's a home in that, the little, I mean, we lived in a cardboard box. We made our house of cardboard boxes, and so there's this sense of like, I'm in a different place here in the United States, mentally, financially, emotionally, but the poverty mindset is always like, like, I'm undeserving of this place. Like, why would anybody want to help me and my family? Like, and so there's a lot mentally, emotionally, that goes in. I mean, even as I share this story, I don't know any of you guys, and I'm about to cry every time I say my story, but I felt that I needed to call or get in here and share that story, my story, with you guys, to tell you guys that you guys are doing a great job. And yes, you guys have seen there is a need, but there's a couple little things that you guys can, revamp, and I think that's why I'm here today.
Maria, thank you so much for sharing your story, for being so vulnerable. I mean, I'm also on the verge of tears here listening to it. And I got to be direct. Like, there are days where I'm also, working full time, raising a family, traveling extensively for work, and doing this as a volunteer. And there are days where I'm just exhausted. And not sure I want to continue. And then hearing a story like this inspires me to keep going. So I just want to say thank you so much for sharing that. And I want to make a commitment to you that we're listening, that if it's okay, we'd like to follow up after. We'll have Sarah or Belen follow up after to get some of these ideas down on paper and we'll talk about them. But my commitment to you is that your story will be it will have meaning. We're going to take steps to ensure that we follow through on some of these ideas and just thank you very much for being here today and for sharing your story. Thank you, really.
You're welcome. And I think, yeah, transportation, you guys hit that one.
Yeah.
Like, man, that's critical.
Yeah, this is an incredibly generous community. I've never seen anything like it. Living in different parts of the world, and I living in Canada. I live in a very small community, but I've never seen a community like in the East Cape of Baja California Sur, the generosity and the commitment from such a diverse group of people with different cultural backgrounds, religious backgrounds, economic backgrounds, political views come together and agree to focus and align on improving the lives of our neighbors and our friends in this area as guests in the country. So thank you. Just want to say thank you again, and we'll definitely follow up.
Adam, if I could just jump in with one comment too. Of course, Maria,
Please.
thank you very much for sharing, and that is very powerful. A couple things that I took away from that is that we do need to always be looking at what our mission statement is and being flexible. And one of the things that, I came into this group less than a year ago, so I wasn't involved from the beginning. But one of the things that drew me to this group was that they never wanted this to be a solution that was dreamed up by some expats and imposed on the local communities. They wanted it to be a solution that came from the community. And with that in mind, I would remind everyone, if you know any locals that want to get involved, please pass on our information to them. One of the things we're working on is getting a panel of people that are locals that can help us do these strategical things with the home that include what our mission is. And the board is very cognizant, and we have discussions all the time about what we should do to change the scope to best fit the needs of the community. So, thank you for sharing that, Maria. And with that, is there any questions from anyone else?
I received a few questions in advance of the meeting, people who said that they couldn't make it at this time and day, but that they had questions and they sent us an email through our web portal in advance. And we're recording this and we're going to share it afterwards. So I'll just go through a couple of them. And then to respect everybody's time, we can wrap up and we will share the recording. And Sarah um, and Maria, if it's okay, would love to follow up with you and have our team in El Cardonal, Sarah and Belen, follow up with you directly, if that's okay as well. One of the big questions, gracias. One of the big questions, and I actually received multiple of these questions in the last couple of weeks, is why is it only for a medical crisis? And would you accept any child in need? And so I know I addressed this at the beginning. It's very specific to our mission, and we want to stay focused. The board is discussing expanding the scope. It's a big decision. It impacts the community. It impacts the facility, the way it's designed. It impacts staffing. It impacts training. It impacts the cost of running the facility. We have had referrals from DIF and others for single mothers who are experiencing emotional and mental distress, and they need housing with their children. We've had requests for children with physical and mental disabilities that need places that they're also living in terrible poverty and terrible situations. Our goal is to protect vulnerable children. That's our purpose. We built the facility with a specific focus, and in raising funds and constructing the facility, we vocalized that specific purpose, and that was the purpose that everyone was behind. And so, will the scope change? Maybe. Are we open to it? we're open to it, but it's a big decision. It's not simply a matter of saying, sure, everybody in need can come. We know there's a lot of need, but we are committed to seeing this mission through, giving it a little more time because we know things take time, and then being flexible as flexible as possible. Through that, I'll say that we do intend to continue to communicate very transparently to the community through this process. So if there are changes, we will inform the community. So that was one of the questions. I received about 4 or 5 of those questions. The other one of the other questions here is, what happens if a family says they want to leave? They say, yes, we do have a crisis. We trust you, take care of our children, but it's not a medical crisis. They're just living in poverty. They just can't manage. Would that be okay? And so it's sort of the same answer as before. We have had that. Would we consider it? Yes, we'd consider it. But again, we have intake forms. We have a process. We also have a permit from the Mexican government for this specific purpose. Hector and Sarah and Belen are going through a recertification process at the state level to expand our reach and eligibility. But to change it would mean a different level of permit. So we're looking at that. We're open to that. So I just wanted to share that other question. And then I guess I wanted to leave it with, what we're intending to do is have a real conversation here, to be transparent, to be open, to say thank you for your continued support and to ask for your patience and continue to support and your help spreading the word. And that's really what the purpose of today is. So if there's no other questions, we can close with that. But if there are other questions, I'm happy to listen.
Actually, I have one other suggestion.
Please.
So, I go to Gobierno de Mexico.mx, gob.mx, and under that website, because technology is becoming more and more, I guess, prevalent in Mexico, we have something called el Buscador de Trámites Federales y Programas Sociales. So if you guys can somehow connect with them and advertise on there, this is really a programa social. Just a little bit background on me. So I became a teacher eventually here in the United States. I went back to Mexico City to study at UNAM, and everything changed. My last position was a director of social services for a nonprofit here in the United States. So really, I see the need for the social, programs that are up and coming, especially with the government that is in power right now in Mexico. I think you guys really are aligned with what they want. So this might be something that could really open a lot of doors through this Buscador de Trámites Federales y Programas Sociales online.
That's great guidance. Sarah, can you respond to that and maybe share some of the structure and the permits and certifications that we have and what the focus is in terms of the government?
Yeah. Well, in this process, we have found that even though we are doing novel work, Mexican laws require us to comply with certain requirements. And that is what we'll be working on as soon as possible, because we are working with DIF, the system DIF in the state. And it's not complicated, but it's a process. So in Mexico, someone can say it will be this work. It could be in 1 week, but Mexico say, well, who knows? No, it's very slow, but we are working on that because we pretend that to be prepared for any situation and to have everything. Hector, if you can help me, to- todo en regla.
And
I'm apologize for my English, but
feel
No
free
worry, you're
to
doing fine.
answer in
You're doing
Spanish
fine.
as well.
Maria, before I add to that, I just wanted to express my appreciation for your heartfelt story and guidance. Your advice is gold to us, and I've copied all of those things down. And rest assured that as one of the people that's responsible for bringing this to life, um, it will be taken into consideration in the appropriate way. I think what what Sarah is trying to say is, yes, your advice about the gobierno.mex is well taken. We are working directly with the government and those organizations that are considered the preeminent or the primary ones for that, DIF being the biggest one. And actually, just a few weeks ago, less than a month ago, I was down in Los Barriles, and Sarah Belen and I met with an attorney that actually runs that program for the entire peninsula, along with social services director, etc. And one of the things that I was pressing on was the issue of Sarah's right. It's not difficult, but it's incredibly bureaucratic and inefficient. And so we're going to have to trudge that road and do it and be very patient. We will get there. We will make sure that we have all of the certifications that we don't have that may be, as we journey this, considered necessary for us to expand the net, if you will, so that we can capture more opportunities. But we're definitely focused on that. And I do love your comment about adjusting the vernacular, the words, and the messaging to the Mexican community in a more meaningful way. That means the world to me because I get it. And I think that these are the things that we have to do. We're going to have to be patient. And Adam's called to the community to us a moment ago when he said, be friendly, be good stewards, be patient. We're going to have to continue to do that because, again, no one else is in this field. No one that we have identified is focusing on this, and the need is there. So we are passionate and committed to making this work.
Thanks, Hector. Thanks, Sarah. I just want to thank you all again for joining today. I want to just reiterate again, this is a community facility. There's no owner of the facility. It's not Leaders to Give's facility. It's for the Mexican community, being run by the Mexican community to serve the Mexican community. It is intended to be a very long-term project. This is not something that we're wanting to do for a couple of years. This is meant to live forever. We do welcome continued questions. We do welcome involvement. We do certainly want to expand the Lideres para Dar board to help guide us. And I think people here, whether you're listening on the recording or you're joining us here today, you have an opportunity to help us write the chapter, to do it with care, with clarity, and most of all with compassion. So thank you everybody for joining today. Thank you, Maria, for sharing your story and for being willing to speak afterwards. And thank you, Sarah and Belen, for a lot of the heavy lifting day to day and engaging with the community, engaging with the government. We understand there's a lot of pressure, a lot of expectation, and we're all very grateful for your service as well. So with that said, thanks everybody. Have a great rest of your day. Bye-bye.